So this is Jayashree hosting this webinar today for this event. We have with us our eminent doctors like Dr. Ganesh Veerabhadraiah, who is our MBBS, DNB neurosurgeon, senior consultant with neurosurgery also, and who has done lots of surgeries, and he has a fellowship like FINR from the Switzerland, who is very specialized with the brain, spine, and neuro and endovascular surgeon as well. So welcome to you, sir.
Thank you. Thank you, Jayashree.
I welcome Dr. Nithin Kumar and our one more eminent speaker for today. He is also with MBBS from Mysore University and MD General Medicine from Hubli and DM Neurology from Mumbai, and a senior consultant with a neurology specialist for 15 years. And he has seen lots of cases with vast experience. And he has been a professor also and MD for the for the brain surgery, brain cases and fast management as well. So I welcome Dr. Nithin as well to this webinar.
Thank you, Jayashree.
Welcome, Dr. Nithin.
Yeah, so we have Dr. Manjunath also, who is associated with our Dr. Ganesh Veerabhadraiah, who is with the DNB. Welcome you, sir. I think we are all aware that why we have gathered over here, because this is one of the very important talk. Every time we miss, and we as a general population, probably this is one of the very important talk after the cardiac. People think cardiac is the more important, but after that, the neuro brain, when it comes to things about the brain surgeries or brain issues, I think people neglect and then come late probably. So we are here to discuss on lots of about the brain stroke and its management and how does it cause and how it is going to help us in future, so that we save our own loved ones and our kids and kins. So over to you, sir.
Hi, I'm Dr. Ganesh Veerabhadraiah. I'm a consultant neurosurgeon. Dr. Nithin is my friend and colleague. We are working together in Fortis Hospital, Cunningham Road. Welcome to everybody. I'm very happy. All you people, in spite of your busy schedule, you have come here and you have joined us to know something about stroke, and want to I know you people, all people want to know about this and prevent their loved one, prevent the occurrence of stroke, or prevent the consequences of stroke which is happening. And today we are going to know about this stroke, what are these types, and what are the symptoms, warning signs, and our Nithin will explain the medical aspect or neurological aspect. He has very well trained and experienced of all this. Next, what I will be presenting surgical aspect and how surgically we can prevent the stroke or benefit the people who are affected with stroke, how to make it more, increase the quality of life. And I will over to Dr. Nithin for presenting the neurological aspect or medical aspect of stroke. Welcome, Nithin, and please, over to you.
So thank you very much, Dr. Ganesh and Jayashree, for introducing us. That was very kind of you. So today, what are we going to do for basically the stroke and its importance, how much the general public know about stroke. There are so many myths about stroke, and many may not be aware of the treatment possibilities and the outcomes. So a lot of questions, a lot of queries are there. So we, as the neuroscience team, me being the neurologist and Dr. Ganesh being the neurosurgeon, we work together and we try to see how much best we can give to the community with respect to stroke as a disease. So without wasting much time, I will start my slide. So I welcome you all again to this important session on stroke. So what do we know about stroke and what are we going to learn about stroke? That is the main theme of this particular session. So I shall be covering the medical part. The medical part means how to detect a case of stroke, how to analyze it, how to investigate it, and how can we give the medications and see that the amount of problem which the patient is suffering can be relieved. And Dr. Ganesh is a neurosurgeon. So what he is going to do is going to speak on the neurosurgical part. if a surgical option is there, if there's any advanced procedures which can take care of stroke, he's going to speak on that because he's got a lot of experience, hands-on experience on treating such cases. All right. So what are we going to do now? I shall be dealing some important, aspects of stroke. First of all, what is stroke as such? What is the burden of stroke? Why do we need to treat it immediately? Can't we treat it, as per our leisure time? Is it possible? We have to treat it as early as possible. That means it is an emergency. So that's important. So what is the treatment protocols? I will not be getting too much into the medical aspects in depth, but I shall give you an overview. You should be aware of certain terminologies. Maybe, somebody within your circle may be having a problem. So you should be in a position to at least communicate with the doctor, like what is he trying to tell us? What do you mean by thrombolysis? What do you mean by thrombectomy? I think some terminology should be something, it is important, I felt. So we will try to bring those terminologies or names in between the discussion. So what is code stroke? What is the use of a code stroke? And the most important thing is why it is important to have an awareness in the public, in the community with respect to stroke. I'll get into all these things one by one. So I have put this slide. Okay, this is a slide I have put here. So what I'm trying to tell you here, I have not put any headings. I have not, there are totally different 3 images which are available here. So, I mean, if you people can make sense out of it, you can just message in the chat box. I will be very happy to see your responses. All right. Yes. Good. Okay, so if you have commented that this could be something related to a accident, and and few have told that this is something related to brain. Very good. So what is it? It is basically when you look at the image on the left hand top corner, what does it look like? It looks like a main switchboard. So what is a main switchboard? You take any apartment, you take any industry, you take your homes itself. There is something called as electrical switchboard, which is a main part. So from here, the electricity will come down to your home. From this, you are able to use your jars, mixies, telephones, charging of the telephones, or fans, and cooler, whatever it is. This is going to be the most important thing. When this is kind of having a problem, you can understand. One day you can feel the absence of this particular thing in your life. So that's why this is an important part of your home. You will be having a fantastic fan or a electrical appliance, but what if the electricity itself is not there? Now this is going to be useless. All right. Now similarly, what are we looking at the right side? On the right side, you are looking at most of you people may be able to pick this up. You may understand what is this. This is basically a car engine. Most of the engineers joining this session will be in a position to understand what I'm trying to tell. This is a car's engine. See, a car engine is so essential, isn't it? You may have the tires, you may have the steering, you may have the gears, you may have, see it beautiful body of the car, everything. But what in case if this particular engine is not there? The whole car is going to stop. It is going to be completely parked forever, isn't it? So similarly, now when you look at these 2 things, how much essential are they? The main switchboard for the home, the car engine for the whole car. How much important are they? Like that, we have the human brain. So the human brain is very important. Everything, see, you sitting in front of us, listening, we presenting it to you, we thinking that we have to present this, and you want to know more about this. All these things are basically, planned, orchestrated, and it's going to be everything coming from the brain. So this is the importance of brain. So when we speak about stroke means brain related problem. That's it, as simple as that. So I brought this image just to make it clear to you that we think heart is very important. We think liver is very important. We think so many minute important organs are very important. Similarly, this particular organ, we don't feel too much of discussion happening on the brain. So I thought that this is foremost. Even if you take heart, I would say this is beyond the importance of a heart in so many cases. Okay, so that is why brain is an important organ. So we have to be very careful, very serious when it comes to brain related medical conditions. So I think this is something which is very clear. Now, I will, one more question I want to ask, maybe I would have asked in the beginning. Very good, somebody has told power control, fantastic. So I know many people have joined, and I don't know which language you people are comfortable. If you people are comfortable in understanding Kannada, then I can speak in Kannada in between. Okay, so that makes you can interact. ನೀವು ನಮ್ಮ ಜೊತೆ ಇಂಟ್ರಾಕ್ಟ್ ಮಾಡಬಹುದು, ನಮ್ಮ ಜೊತೆ ಪ್ರಶ್ನೆ ಕೇಳೋಕೆ ಅಥವಾ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳಿಕ್ಕೆ ತುಂಬಾ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ ಅಂತ ನಾನು ಅನ್ಕೊಂತೀನಿ. ಸೊ ಇದು ಮೇನ್ ಸ್ವಿಚ್ ಬೋರ್ಡು, ಇದು ಕಾರ್ದು ಇಂಜಿನ್, ಇದೇ ತರ ನಮ್ಮ ಮೆದುಳು ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್ ಇರುತ್ತೆ. ನಮ್ಮ ಎಲ್ಲಾ ಕೆಲಸ ಕಾರ್ಯಗಳಿಗೆ ಮೆದುಳು ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಸ್ಟ್ರೋಕ್ ಅನ್ನೋ ಏನ್ ಕಾಯಿಲೆ ಇದೆ ಅದು ಬ್ರೈನ್ಗೆ ಸಂಬಂಧಪಟ್ಟಿದ್ದು. ಬ್ರೈನ್ ಅಲ್ಲಿ ಏನೋ ತೊಂದರೆ ಆದ್ರೆ ಇಡೀ ಶರೀರನೇ ವೇಸ್ಟ್ ಆಗ್ಬಿಡುತ್ತೆ ಅಂತ ನಾವು ಫಸ್ಟ್ ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು. ಓಕೆ, ವಿಲ್ ಮೂವ್ ಟು ದ ನೆಕ್ಸ್ಟ್ ಸ್ಲೈಡ್. 1 second. Okay, what is stroke? Stroke means it is damage of brain. It is damage of brain due to what? Due to a problem in blood flow to brain. When there is a blood flow to brain which is disturbed, how can it be disturbed? Maybe the blood is not going to brain, or the blood which was in the brain started bleeding out. So these are the two modes in which the blood flow to brain is disturbed. That is why this particular condition is called as stroke. So damage of brain due to disturbed blood flow in brain. That is as simple as that. So when there is blood flow problem, why is it so big deal? When there is no blood flow to brain properly, why would there be so much of complication? The reason is, sorry, brain is a very delicate organ. Brain controls each and every movement of the body. Your hands, legs, tongue, eyes, face, emotions, everything is controlled by the brain. When that is a situation, if there is a small portion of the brain which is damaged due to reduced blood flow, that portion will not, that part of the body which is controlled by that particular brain tissue will not be functioning. For example, let us say the right hand. We are using right hand to write. In the brain, in the left hand side, there is one area called as motor area or activity area, let us say. If that area is getting a damage due to disturbed blood flow, then the hand will not function, isn't it? So as simple as that. Or it will be because of language area. There is something called as language area. Like that, we have got vision area, memory area. All these areas, if they have got any problem related to blood flow, that particular portion will not work. That is why this becomes a case of stroke. What are the common terms? The common terms, see, in Karnataka, we call it as lakwa or parshvavayu. Okay, so ನೀವೆಲ್ಲ ಕೇಳಿರ್ತೀರಿ ಲಕ್ವ ಅಂದ್ರೆ ಏನು, ಪಾರ್ಶ್ವವಾಯು ಅಂದ್ರೆ ಏನು. ಸಾಧಾರಣವಾಗಿ ಕಾಮನ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಅಲ್ಲಿ ಇದನ್ನ ಈ ರೀತಿ ನಾವು ಅದನ್ನ ಉಚ್ಚರಿಸ್ತೀವಿ. ಸೊ ಸಡನ್ ಆಗಿ ಮೆದುಳಿಗೆ ರಕ್ತ ಸಂಚಲನೆ ಕಡಿಮೆ ಆಗುತ್ತೆ, ಕ್ಲಾಟ್ ಆಗಿರ್ಬೋದು ಅಥವಾ ಬ್ಲೀಡಿಂಗ್ ಆಗಿರ್ಬೋದು. ಅದರಿಂದ ಮೆದುಳು ಡ್ಯಾಮೇಜ್ ಆಗುತ್ತೆ. ಮೆದುಳು ತುಂಬಾ ರಕ್ತದ ಮೇಲೆ ತುಂಬಾ ಅದು ಡಿಪೆಂಡೆಂಟ್ ಇರುತ್ತೆ, ಅದ್ರ ತುಂಬಾ ಅದಕ್ಕೆ ಅವಶ್ಯಕತೆ ಇರುತ್ತೆ. 1 ಸೆಕೆಂಡ್ ರಕ್ತ ಸಂಚಲನೆ ಬ್ಲಾಕ್ ಮಾಡಿದ್ರು ಸಹ ಬ್ರೈನ್ ನ ಒಂದು ಪೋರ್ಷನ್ ಒಂಥರ ಸತ್ತೋಗ್ಬಿಡುತ್ತೆ ಅಥವಾ ಕೊಳ್ತೋಗ್ಬಿಡುತ್ತೆ ಅಂತ ಅನ್ಕೊಳ್ಳಿ. ಅಂದ್ರೆ ಇಟ್ಸ್ ಗೋಯಿಂಗ್ ಟು ಬಿ ಡ್ಯಾಮೇಜ್ಡ್. ಹಾಗಾಗಿ ಆ ಮೆದುಳಿನ ಪೋರ್ಷನ್ ನಮ್ಮ ಕೈ ಅಥವಾ ಕಾಲು ಅಥವಾ ಕಣ್ಣು ಯಾವುದೋ ಒಂದು ಪೋರ್ಷನ್ಗೆ ಅದು ಕನೆಕ್ಟೆಡ್ ಇತ್ತು ಅಂತ ಹೇಳಿದ್ರೆ ಆ ಪೋರ್ಷನ್ ಕೆಲಸ ಮಾಡಲ್ಲ. ಸೊ ಮೆದುಳಿನ ಇಂಪಾರ್ಟೆಂಟ್ ಹೀಗಿರುತ್ತೆ, ಮತ್ತೆ ಮೆದುಳಿಗೆ ರಕ್ತ ಸಂಚಾರದ ಇಂಪಾರ್ಟೆಂಟ್ ಹೀಗಿರುತ್ತೆ. ಓಕೆ, ಅದಕ್ಕೆ ನಮಗೆ ಮೆದುಳಿನ ಬಗ್ಗೆ, ಸ್ಟ್ರೋಕ್ ಬಗ್ಗೆ ನಾವು ಯೋಚನೆ ಮಾಡ್ಬೇಕಾಗಿ ಬರುತ್ತೆ ಸೀರಿಯಸ್ ಆಗಿ. ಆಲ್ರೈಟ್, ಸೊ ವಿಲ್ ಮೂವ್ ಆನ್ ಟು ದಿ ನೆಕ್ಸ್ಟ್ ಸ್ಲೈಡ್. So what is the burden of stroke? The burden of stroke means what? What is the amount of stroke cases all across the globe? How many people have a problem in doing their activities? How much of money is lost from each family? How much of economy is lost in each country? Like that. And how much of emotional disturbance happens in each individual? So there are so many different parameters. We'll have to look out for most common parameters, and we'll have to get one idea about it. Okay, so somebody has raised their hand. I'll just try to understand. Okay, fair enough. Welcome Rishi, welcome Hema. Now I'll come to the statistics now. World statistics and Indian statistics. Let's try to compare. See, you will be surprised that around 20 million people suffer from stroke every year. 20 million cases. Okay, that means almost 2 CR cases suffer from stroke every year. It causes around 5 million deaths. Okay, it causes around 5 million deaths, and there are around 5 million people who are rendered disabled because of stroke. So, what do you mean by disabled? Disabled means handicapped. Okay, handicapped. You have seen patients with handicap state, right? So they'll not be able to use a right hand, right leg. They'll be holding on to some crutches or the other side, or they'll be in a position not use a leg at all. So they need a wheelchair. Now this is what is a state of being handicapped. Okay, so that is also called as disabled. That's a medical terminology we generally use. Okay, so if you look at the whole population, let us say in your surroundings, if you take a graph of all the individuals, let us say there are some 10, there are some 6-7 individuals, you take a graph of them, out of 6 individuals, 1 person is likely to get stroke in his lifetime. That is the amount of common presentation of stroke. Now we don't have to think that stroke is something which is not which is very rare, which doesn't come to us. We are safe because we practice healthy lifestyles. Not healthy lifestyles, sorry. We have not seen stroke cases around us, so it may not come to us. No, this is something which you should be careful about. The statistics says that 1 in 6 individual can have stroke in their lifetime. Okay, so we will tell you what are the ways to control stroke. How can you prevent stroke? That will tell you as the slides come up. So what is Indian statistics? If you look at India, there is 1.5 million people who suffer from stroke every year. Every year you're getting almost this much number of patients with stroke. Around 3,000 to 4,000 Indians suffer from stroke every day. From Kashmir to Kanyakumari, if you take around some 3,000 to 4,000 people having stroke every day. You can see the gravity of situation about stroke in India itself. Stroke causes more deaths in the country than malaria, tuberculosis, and HIV combined. So the number of stroke cases and the number of deaths due to stroke, if you just look at the number, you add all the cases which are dying because of malaria, tuberculosis, HIV, all put together, it is beyond that, more than that much number together. So this indicates that this is a more common, complicated condition which we have to look into. Okay, so ಇಲ್ಲಿ ಏನ್ ಮಾಡಿದೀವಿ ನಾವು, ಎಷ್ಟು ಕೇಸ್ಗಳು ನಮ್ಮ ಸ್ಟ್ರೋಕ್ ಕೇಸ್ಗಳು ಪ್ರತಿದಿನ ಆಗುತ್ತೆ ಅನ್ನೋದು ಇಲ್ಲಿ ನಮ್ಗೆ ಗೊತ್ತಾಗುತ್ತೆ ಅಲ್ವಾ. ಸೊ ವರ್ಲ್ಡ್ ಅಲ್ಲಿ ಎಷ್ಟಿರುತ್ತೆ, ಇಂಡಿಯನ್ ಅಲ್ಲಿ ಎಷ್ಟಿರುತ್ತೆ, 3,000 ದಿಂದ 4,000 ಇಂಡಿಯನ್ಸ್ ಸ್ಟ್ರೋಕ್ ಅಥವಾ ಲಕ್ಕು ಆಗುತ್ತೆ ಪರ್ ಡೇ. ಓಕೆ, ಆಲ್ರೈಟ್. ಸೊ that's just a little bit of information, statistics. ನಿಮಗೆ ಗೊತ್ತಾಗ್ಲಿ ಏನದರ ಕತೆ ಅಂತ. I'm just highlighting that. Okay, all right. All right, okay. So somebody has told who can see your messages recording on. Okay, I think this is being recorded possibly. Dr. Ganesh is looking into that possibly. I'm not very sure.
Yes, yeah, we will be recording it, and
okay.
Yeah.
Dr. Ganesh is recording it, so I think that should not be a problem.
It will be given to everybody who has
joining us. We will try to. You will get it. Okay, and yeah, the next slide. Now I'll tell you, this is another important slide which I want to highlight. What is happening is, let us take heart attack and stroke. These two conditions separately we'll see. We're not taking any other infection or TB or that in this. Only you take heart attack and stroke. Two conditions you take it. Okay, if you take these two conditions, what is common in them? Heart attack happens because of a blockade of blood vessel. The blood vessel goes to heart, that is blocked. So immediately you all know that there are medicines to dilute the clot, and they'll put a stent and the patient is back to normal most of the time, isn't it? Even in brain, same thing happens. But here the blood vessel is in the brain. The blood vessel and clotting happens in the brain. That is a difference. So these two conditions have similar, what do you call it, cause and kind of outcome possibilities. All right. Second common thing is, both are an emergency. Heart, when there is a clot in brain, the clot will cause damage to the heart. That is what you call it as heart attack. Similarly, when the clot goes to brain, it's called as brain attack or stroke, as simple as that. And the outcomes are complicated in both of them if you don't take care of it. This is the common thing I'm telling you. So why am I bringing this slide here? What is the reason? The reason is as simple as this. In the common scenario, in the common public domain or scenario, anybody who has got a heart attack will be immediately picked up by the bystander, by the relative, by a passerby in the road. Somebody falls down with holding the hand here and just sits down on the ground in a road. Any random passerby will lift him up and take him to the emergency to a nearby hospital because he knows that this is a heart attack. Okay, so that means to say, when there is a heart attack, it is very easily understood by the community. You don't have to tell about heart attack. You have to just tell that there is pain. You don't have to tell that also. You just have to hold around the abdomen. Even if there is gastritis, there are people who think it is heart attack and they rush to the hospital. Okay, now come to brain. When there is a brain attack or when there is stroke, what happens? When there is stroke, how does the stroke, before you know how does a stroke present, you should know some common or basic things. I told when there is stroke, there is a clot in the brain or there is a bleeding in the brain. But how will the patient present? They will present very silently. They are sitting on a chair. Their hand became weak. They'll become just the hand will drop down. Their speech is gone, so they're not expressed. Their legs are so they'll be sitting on the chair for some time. Second thing, when a relative looks at them, they will think that he has got some giddiness or he had eaten something which is causing some gastritis or something. The food was not okay. Or even if they pick up that there is some problem, when they take to the hospital, they'll take to a nearby physician or somebody who will think that maybe his BP is fluctuating, or they may ask for a scan, and the scan will be done. It will take another 20-30 minutes or half an hour for the scan to come. So that is a picture in a stroke case. That means a stroke case is something which you cannot immediately pick up. If somebody is aware of stroke, then they'll tell this looks like stroke, we have to immediately take to the hospital. But since we are into this neurology and neurosurgery, we know how the public, kind of reacts to stroke. That kind of emergency and urgency when it comes to heart is not there in case of stroke. Now, why it is important to stress on this factor is, see, treatment is also immediate for both of them. See, cardiologists will say there is something called as golden hour. Within this 1 hour, 2 hour, you have to bring the patient to the hospital. We also will tell you have to bring the patient within this period of time so that we can start the treatment. But cardiologists will be getting the patient immediately without much kind of, you don't have to tell him. The patient will come immediately to the emergency department. He'll immediately take to the cath lab and he's most likely to put the stent into the heart. You come to the neurology part. When it is stroke, this is not the case. You can, blindly trust me because I'm a neurologist and I've seen this happening. So even in educated families, they give time. They think that maybe he's got some weakness because he has not slept well. So that is why he's, having this, they think that he's got some dental weakness. He didn't eat well. So they'll take time. So the urgency is lost. Okay. So I'll be telling you the common symptoms. Before the common symptoms, we'll see some basic things which I want to tell you. I'll tell you. So stroke is something which is like an urgent condition, and you need to take the patient to the hospital as early as possible. All right. Now, these are some of the risk factors. You take heart as well as stroke. Same it is. Smoking, alcohol, your diet. If it contains all these, chats and too much of cholesterol in that's going to be a risk factor. Drug abuse can be a risk factor. Physical inactivity, you don't do any exercise, you can still be a patient who can, in future develop complications like stroke. How can doctors modify? Doctors can modify few things, but not everything. Modifying BP, sugar, increased cholesterol and heart conditions and all those things can be something which the doctors can help you, but not other things. Okay. So now, what are the type of stroke? All right. I'll come to the symptoms of stroke. Somebody's asked me about the symptoms of stroke. I'll explain to you when we come to that particular slide, right? Now, what are the type of stroke? Initially, I told that there are two type of strokes. One is a stroke which happens because of reduced blood flow to brain because of a blockade or a clot in the blood vessel. And the second one is because of bleeding in the brain. Okay. If you can appreciate this, this is a brain scan. There's also a brain scan. We have just cut the brain, from top to bottom like this. We have made it in two portions, front and back. Now, this is the area where the blood flow. There's a blood tube which carries blood to the brain like this. Okay, from the heart, the blood will come, it will go like this. All right. Now there is one clot here. Because of the clot, the blood is not going. So what is happening? You can see that the brain over here, this is looking how? This is looking grayish compared to the pink area of the brain. Correct? That means there is no oxygen, there is no blood, the brain cells are dying. That is called as ischemic stroke or clot related stroke. All right. Now I wouldn't go into the details of this thrombotic embolic strokes now because of the one is want of time, and second thing is, since most of the people are from the non-medical field, I want to keep it focused on the main theme rather than getting into technical aspects of stroke. All right. Second thing, here is another type of stroke. You can see the difference. What is happening here? What is happening here? Here there is bleeding happening in the blood vessels of the brain. The blood vessels are broken and then the blood has come out. Why the blood vessel is broken? It is broken because of high blood pressure most of the time, or the blood tubes were by birth not very healthy. They were very thin, so they had chances to rupture and blood came out. So both these things can cause stroke. One is called as ischemic stroke, second is called a hemorrhagic stroke. All right. Now, why is it important on these two? Because the treatment plan is different. One is west, one is east. They're totally like, the treatment, as far as treatment is concerned, some drugs which you give for ischemic stroke, you cannot give in hemorrhagic stroke at all. So that is why it's very important to understand this for the doctors, for the junior doctors, so that they can approach the case appropriately. All right. Now, somebody was asking about the symptoms of stroke. So here I will elaborate what are the symptoms of stroke. See, most of you people in the society, most of the people within your circle itself, maybe the friends, some friends, relative, or somebody, you went to visit some patient, who had some fever, but in the next bed you would see some patient with stroke. So some kind of experience, or even in social media or in movies, you would have seen, patients coming with, presenting with stroke. All right. All right. Okay. So now the thing is, you need to know how stroke presents. All right. Very important. I will be touching upon some basic presentation of strokes. Okay. There are so many ways of stroke presentation. There are types of stroke which even sometimes, even a general physician can miss it. General physician can miss it. Doctors at the peripheral level, maybe in the community level, sometimes can miss it because they're exposed to unusual cases of stroke. Okay. Now I'm going to speak about the common types of stroke. Like presentation. See, let us say, the brain has got two portions, left and right. Okay, left and right. Now, left brain takes care of right half of the body. Right brain takes care of left half of the body. So it's like opposite. Left brain, right-sided body parts. Right brain, left-sided body parts. All right, that's it. This is a very common type of stroke. Now, let us say a patient has got a stroke or a clot which has happened to the right side. Let us take this patient only. This image itself is, this cartoon itself is sufficient for me to explain. What has happened is, see, if you take this brain, there are two portions. Okay. This is the right portion. This is the left portion. In the right portion, suddenly this patient had a clot or a bleed, let's say. Suddenly he developed stroke. What happens? See, left half of the body, you can see from top to bottom, there are so many changes. You compare to right side. Okay. Now what has happened is his face has deviated to, his lips have deviated to the right side. That means left side is weak. His eye on the left side is looking so weaker compared to right side. His hand is weak and his leg is also bent. That means he will have difficulty in, he may have difficulty in seeing things. He may have difficulty in balance. He may have an asymmetry in the face. He may have a, face turned to one side. All right. An arm and leg he may not be able to lift up. See, we tell the patient to lift the hand up above the shoulder level. No, that may not be happening. And he may have a problem with the speech. He can't speak. Or he may be having giddiness. he may be having confusion. All these possibilities are there. And this will present like this. Suddenly it will present. Stroke is an acute or an urgent, emergent, very abrupt presentation. Suddenly it will happen. Stroke will not happen slowly. Today it will start and tomorrow evening it's going to end. It is not like that. Stroke will start now and within few minutes it's going to end. That is why time is very important. We have to bring the patient immediately to the hospital. Okay. Now look at this. This patient has got something called as balance problem, eye problem, face which is asymmetric. He's got an arm, leg which is weak, and then there is speech involved. See, if you look at this one, FAST, with these four things, just for the public awareness, most of the governing bodies of stroke have come out with the concept called as FAST. See, FAST, FAST. What is FAST? Face, arm, speech, and time. That means if somebody suddenly has deviation of mouth to one side, can't lift the hand, or has got weakness in the arm, has got weakness in the leg, cannot stand, that means it is stroke. So time is important. T means time. Immediately you should bring the patient to the hospital. Okay. So just 1 second, I'll just check if somebody has any questions. Sure, we will answer. Okay, in my case, immediately got it. Okay, okay. Thanks, Dr. Okay, very good, very nice. So Dr. Ganesh, they're thanking you. Okay, yeah. Common symptoms of stroke, very good. Yeah. Immediately, very good, very good. And somebody wants me to speak in Kannada. I will try to speak. None of them have message there, so I assume that this speaking in English is okay to you. All right. Now, so these are the common symptoms of stroke. What is important? First is acute. That means suddenly it will present one. Second thing is it will involve one side of the body, face, arm, leg, even eye, vision problem like that. And sometimes there'll be difficulty in speaking. Sometimes they'll have, lot of giddiness. Sometimes they may have some shaky hand and shaky leg, loss of coordination, loss of balance. These are all presentation of stroke. All right. So keeping this FAST, see here, FAST, whichever I have ticked, FAST, I have ticked. So these four things are called as fast approach or fast algorithm. When I tell a common person that you should know about fast, means he'll understand that. That means this is indicated in stroke. That's why this has been propagated in most of the hospitals. Whenever there is a stroke discussion, they bring out this fast algorithm. All right. Now I'll move on to the next slide. Yes, yes. Now this is a slide which is basically not for the general public, but I'm just putting it here just to make you understand that how doctors approach a case of stroke. We look into the level of consciousness. We look how the patient is looking. We look at the facial weakness, hand weakness, leg weakness, whether he's got difficulty in coordinating, sensations he's able to understand, he's able to speak. Okay, all these things we take and we start putting grades for them. Consciousness, he is very conscious, no consciousness, for that one grade. Like that, we start giving a rating for this stroke. This is also important because we'll tell whether it is mild stroke or severe stroke. When you know that it's a mild stroke, what you need to do, the doctor will decide. If it is a severe stroke, what to do, the doctor again will decide on that. So this is important as a technical aspect. In general public, this is not very, very important. Okay. Just for curiosity, just for you to know that what doctors do at the back end, I'm telling you. And this particular scale is called as National Institute of Health Stroke Scale or NIH scale. This is a very important scale. All the doctors, all the neurologists in particular will be knowing in detail. So when a patient is brought to the emergency department with stroke, we go through all these things within 5 minutes and we put a grade. Say like this, we put a grade. If the scoring is 0, that means no stroke. If the score is 21 to 40, that means severe stroke, like that. We grade it so that we can optimize the medication. You know how much medication we have to give. All right. So why is stroke an emergency? Why am I I've been telling that stroke is an emergency, stroke is an emergency. Why it is an emergency? See, because the most important thing is once there is a blood flow problem to brain, the brain cells will start dying every second. It is said that around 2 lakh brain cells can die within a minute. Around 3,500 cells can die per second. Brain cells can die per second. So time is very important here. You can't wait. The moment you treat early, the brain cells will start surviving. So the condition is very similar to heart attack, acute myocardial infarction. Outcomes are very bad if you don't treat on time. And during stroke, every second counts as the brain cells are lost rapidly. So there is a concept called as time is brain. That means you have a problem with stroke. That means you have to tag it with time. Every second counts now. Every second, 1 second, there is 3,000 to 3,500 cells are dying in the brain. All right. So that's why faster you get, faster the patient will recover, and ultimately the patient will be healthy. Patient will not have too much of problem. Okay. All right. Very good. Now, so so this is just a little understanding for if you guys can understand. I'll anyway tell you. See, the per second I told around 32. Sorry, it was 32,000 cells. Per second, around 8 so the number of years the brain ages will be around 8.7 hours. That means that much years will be lost. That much amount of years will be lost. Okay, and then per minute, around 2 million cells will be dying per minute. So like that, per hour, around 120 million cells will die. Per stroke, around 1.2 billion brain cells can die. Okay, so this is very important. So one error I told, that is per second around 32,000 brain cells can die. Please note it. Okay. All right. So we'll go to the next thing. Treatment should start immediately. See, there is something called as window period or golden hour. That means the patient is brought to the hospital. The doctors are going
I think some network error with Nithin. Just a few minutes, I'll come back.
Yeah. Ganesh, can you hear me?
Nithin, yeah, some network error was there. Yeah.
I'm sharing
continue.
a slide again.
Continue.
Sorry for that. Am I audible?
Yes, you are audible. You are audible. Fine.
Yeah. So since every cells of the brain will die after the stroke, we have to treat the patient as early as possible. See, there's something called as within 4.5 hours of treatment. That's called as golden hour. So the patient should be in the emergency department in the hospital within I see 4.5 hours is the length of time, but our request is that the patient should come as early as possible. Even within 1 hour the patient comes, it is even better. That is the upper limit, 4.5 hours. So see, once the patient comes to the hospital, the doctors have to assess the patient. The doctors have to get the blood investigation done. The doctors have to do a brain scan. So there is a lot of time which is going to go there. So the moment you come, we cannot, treat immediately. Okay. Treating means what do? We use a particular injection to dissolve the clot. Okay. It's called as clot busting agent. Okay. That particular clot busting agent has to be given within this much period. It should complete. Once you start the injection, it should complete and get over within this period. That's always better. Okay. So bring the patient as early as possible. That is the concept there. Right. So how doctors approach a patient with stroke, I told you how they examine. Then there is scans called a CT scan, MRI scan, and digital subtraction angiography, which Dr. Ganesh is an expert on that. He's going to speak on that. Most of you are aware of what is a CT brain and MRI brain. Okay. CT is something which you can do immediately. MRI is something may not be available in all the centers. So CT scan is more than enough for us. Okay. This is a simple kind of, scan. This is a scan of a patient with stroke. And I'll tell you what is, this is the blood tubes or the blood vessels which goes to the brain. So what is happening here? The brain, you can see this is the brain. You take a cross section. We call it as cross section. You take the brain, the scanner, and then you take the sections like this. Right? When you take the photos, no, you have to take sections like that. When you take sections, this is how the brain of a patient with stroke will look like, who has got a clot in the brain. So there is one area which looks like a triangle, isn't it? Look at this, it looks like a triangle. That is the area which has got damaged because of a clot. So we diagnose like this. Okay. Now what is the amount of damage? Depending on the size of the clot, we will decide what treatment to be given. Okay. So you can see here one of the blood tubes also. You just focus on this image. You see on this right side, so nicely the blood vessels are like this, going into the brain like this. But on the left side, you can see the blood is going and stopping here. See there, you can see that it is stopped there. That means blood is not going to this part of the brain. This is the same part of the brain, what I'm speaking about. Okay, so there is a damage, right? This is just an idea like how doctors are investigating and diagnosing. Okay, all right. Similarly, this is an MRI of that was a CT scan. What I showed, this is a CT scan, and this is an MRI. All right, again, there are some color changes here. With that, we can pick up right side brain is looking bright, left side brain is looking not bright. So right side one is the one which has got a clot inside. All right, like that. See here again, there's a bright area in the brain in the middle. That is the area of the brain which takes care of left side of the body. So that is damaged because of a clot. So the patient will have left side stroke. All right. Here there is a clot in the other portion of the brain. So similarly, wherever there is a clot, the patient will have weakness or problem on that side. Okay. So what is the treatment plan? How do we treat these patients? The treatment is given by, see, when we know that there is a clot in the brain, in the blood vessel, the treatment is to dissolve the clot. That's it. We have to dissolve the clot. See, by giving some tablets, you can immediately dissolve. There should be a method where the injections are given through a blood tube. That particular medicine will travel the blood vessel and go to the brain and act on the clot and dissolve it. Okay. So that particular technology or that particular method is called as thrombolysis. Thrombus means clot. Thrombolysis means dissolving the clot. Okay. Either you can put an injection and dissolve the clot, or you can remove the clot itself. Dr. Ganesh is an expert on that. He has a method in which they use certain guide wires and certain procedures through which the clot itself is removed. Okay, so you can see the advancement in stroke management. Almost 25 to 30 years back, we did not have such facilities. So of late, I mean, even now, there are so many centers who are not doing these things. So it is up slowly, it's a learning curve for all of the neurologists and people in the neurosciences to do this. Many fantastic centers are there where this particular technology is used. All right. So, and of course, one is the removal of the clot. Second is all supportive measures and to prevent the complications. All right. This is just the name of the drugs what we generally use. The one which is commonly used is the alteplase. What we are using is the alteplase and sometimes tenecteplase. All right. And then what is the dose of the drug? 0.9 milligram per kg body weight we inject. Okay. There is a technique in giving that. Okay. So we are facing some real problems. What do you mean by that? See, I spoke about what is stroke, how the clot happens, and what are the presentations and why is it emergency? Why should we treat it on an emergency basis? I've told all these things. But in a real life, is it possible that the patient with the problem is immediately diagnosed and the patient is brought to the hospital and the doctor is immediately able to take care of that? There are so many hurdles. It is not possible. See, in a busy traffic in Bangalore, in a city like Bangalore, or even small towns also have a problem now. There's a lot of traffic happening and a lot of communication problems happening. So that is one thing. So by the time the patient reaches the hospital, there's a lot of delay. That golden period or winter period is lost. Okay. And then what about the doctors? There are so many centers which are coming up, with respect to thrombolysis. Not all centers will be in a position to do it immediately. Okay. So there are some centers called as stroke ready centers, or where the neurologists are experienced in managing stroke. There the patient has to immediately go. And then the center, the hospital should have a properly planned diagnostic center, diagnostic services. There should be a CT scan, possibly an MRI. They should have the lab facilities and a proper emergency department. All right. Of course, the neurologists and the neurosurgeons are very important part of this particular system. All right. So strokes are acting fast. Can you or could you act fast? Stroke is challenging you by coming very, fast. It has got a certain speed which nobody can pick up. But are we ready to treat it that fast? That is the question. Okay. So we have to be fast, right? So the time which is taken to suspect a stroke from then to bringing the patient to the hospital within 10 minutes, assessment within 15 minutes, getting a CT scan within 25 minutes, and understanding the CT scan, whether it is a clot or a bleed, within 45 minutes, and then giving that injection, that special injection which I'm telling, which is a clot buster, within 60 minutes. Is that a possibility? It is a possibility if you all follow the protocols. The patient and the community should be in a position to understand that this is stroke. That's first point. Second thing, doctor should be immediately available during that particular problem, and the hospital should be ready to treat such patient. Scans should be ready. Diagnostic services should be ready, and the whole team should be ready. Then this is going to be a successful, kind of a venture. So once you treat the patient of stroke properly, immediately, you can see so many patients recover fantastically. Dr. Ganesh will show the examples. How many patients have done very well? They have come back to us. They have appreciated us, isn't it? So that is why it is very, very important to have these in this loop healthy and complete. Okay, so we need a stroke protocol as well as stroke team. This is for the hospitals. All the hospitals should actually have a system, a doctor, the emergency department, the intensive care department, the neurologist, all should be tuned to handle stroke cases, and they should form a team. They should coordinate. So what is a team of stroke specialists comprise of? We have the emergency physician. There are physicians who take care of the patient immediately when the patient comes in. Okay, very good. Somebody says I'm an example of Dr. Ganesh treatment. Good, good, fantastic. There should be an emergency physician who's trained. There should be a stroke nurse, neurologist, neuroradiologist who can pick up the scans correctly and tell us. Sometimes there are so many mistakes which can be made while reading the scan. So a neuroradiologist is going to be a useful person there. Neurosurgeon, whenever there is big bleed, surgeons can immediately operate that. Stroke unit. Okay, and then there should be some coordinating there. All right. So almost 1 or 2 slides left. So I'll just try to, okay, that's code stroke. For everything, there is a code. There's an emergency code. Suddenly, if there is a disaster, let's say there is fire in the hospital, there is something called as one code for fire, so that everybody will come and assemble in one particular point, and there are some people who are assigned to take care of the, to extinguish the fire. Like that, when there is stroke, this particular code means all these doctors should be in the loop. They should be alerted, so that the doctors will take. All right. So this is again a part of the code stroke. See, let the patient, if the patient is coming from outside, or where an emergency doctor goes and picks it up, or a patient comes by himself to the hospital, what all we are supposed to do? The doctors are trained. So they're trained, they are having so much of experience to treat such cases. All right. So stroke protocol is basically implementation to improvement of stroke care. From the implementation of the stroke protocol till you go on end treating the patient properly and seeing the outcomes. So who's going to take care of the quality of this particular system? So the quality is looked after by one of the team members who's going to be working like a quality assurance person. Okay, they'll look at what time the patient arrived, at what time we are doing it, are we following all the protocols, did the patient get all the ABCs which are supposed to be done for stroke. And from the beginning till the end, until the patient goes out of the hospital, there should be a certain quality which is made. So in the coming years, most of the hospitals are going to have this particular kind of system. So this is one of the last slides. So time, this is a kind of summary thing I'm telling you. Time is brain. The earlier the treatment is established, the greater the chances of reducing brain injury. That's the first point. Second thing is the window period, the golden period within which the patient should be treated for acute stroke is 4.5 hours. We give a drug called as alteplase, and that technique is called as thrombolysis, intravenous or injection related thrombolysis. And third thing is door to needle. That means how early you can put the patient on the treatment. That is very important. This is a major circuit of management of acute ischemic stroke. So acute ischemic stroke. So if you have to summarize, how do I catch up only few points and bring it to you so that you can keep it in your mind? One is treat stroke as you treat a heart attack. Be very conscious about that. That's the first point I would tell you, because both are similar. So second point is every second will count. Time is brain. Immediately you should bring the patient to the hospital. Even within the first half an hour, 15-20 minutes, how early you're going to bring, that much it's going to be beneficial for the patient. Okay. So this needs a team. Just one doctor, one neurologist cannot do this work. You need an emergency physician, you need a ICU care doctor, you need everybody. You need even the patient party to support them while taking consent for thrombolysis or any procedure, the family should trust the doctor and proceed with it. They'll be anyway counseled about the advantages, disadvantages, that this everything will be told, but they have to also get in as a part of the team. So that's it. And most important thing is the awareness in the public. See, stroke as such is not a very easy subject for everybody to easily understand, nor anybody will really enjoy discussing these medical conditions so easily. But of course, without 1 second, please go on there. Am I audible, Ganesh?
You are audible. Yes, Nithin, you are audible. Please go ahead.
I thought my network went off.
No, no, transiently for few seconds it went, but it is fine now. Please go ahead.
Acha. So possibly I was telling you about awareness amongst the public is something very important. So that is the reason we are here, and we would like to do few more taking your feedbacks. Okay, we are all doctors, so we have a different language, but what you want, you can give us a feedback accordingly. We can come back to you regarding the same topic, so that the awareness is more created in the society. All right, so that would be my last slide. And okay, somebody says, okay, Hashmat says, thank you so much, doctors, it was really a fabulous session. Thank you very much. Thank you very much. Okay, very good. So now I would this is the end of my talk over here. So it's my pleasure to give the stage to Dr. Ganesh. So he's going to come out with some fantastic case outcomes and his experience and everything, which are definitely going to keep you intact for the next part of the session. Thank you very much.
Thank you very much, Nithin. It was a wonderful presentation, and as we all know, neurology or neuro is a very difficult subject, even in our MBBS days or and after that also. And this, whatever the brain stroke or neuro, this thing webinar we are presenting, these are very high, very complicated medical terminologies. And also it is very difficult to make it very simple and make public to understand. Dr. Nithin has done a really wonderful job, and most of the things which I also want to, my topic also is covered by Nithin, because the surgery involves both the medical aspect and surgical aspect. And thanks, Dr. Nithin. And now, and thank you for so many people who are attending now in spite of their busy schedule. Ashmat Unnisa, Hem Chandra Upreti, Hema Malini, Mohammed Fasiuddin, Naveen, Raghavendra, Rishi, Dr. Srinivas Murthy sir, Shweta, and Vaibhav, and so many people. Thank you for joining us. And if any questions you have, please put it in the this one, the chat box now, and also you can message in our WhatsApp numbers which we have already given. So all the questions will be discussed at the end. And now I am going to share my screen. Actually, what I will do, since Dr. Nithin has presented most of the things, I'll be talking about surgical aspect, and in a simplified words I have put in a mind map, and it is like a summary of everything. And it is a huge topic, the brain stroke, and if we discuss throughout the day or weeks, we can discuss completely, but I have tried to make it simple. In the beginning, I will show the board view points and mind map, and after that we will be presenting one small presentation, PPT, PowerPoint presentation, me and Dr. Manjunath. And there are so many patients or so many cases we have, and everything we can't, because of the time constraints, we can't present everything as of now. Okay, and please stay till the end. And these are the points I would like to discuss. The values. Initially, I want to introduce whatever we are going to discuss and why we are doing this. And I want to discuss about the facts and a few myths of stroke and types of stroke. I think Dr. Nithin is already discussed. And in the treatment aspect, medical aspect, Dr. Nithin has already discussed. And what make neurosurgery or neuroservices effective, and how the quality, and finally take home message. So many things I would like to skip it. And the values, what we are going to learn is the awareness, the brain stroke, like our Dr. Nithin said. It is just like a heart attack. Actually, heart attack, so many people in the public, they know as soon as they get the heart attack, they will come and get admitted, and they will get the treatment. Because heart attack is a painful condition. They will get either chest pain, hand pain, or gastritic like pain, and immediately they will come and get admitted, and they will take the treatment. That's why it is this compared to stroke. Stroke is a painless condition. If the patient develops, like Dr. Nithin says, facial weakness, hand weakness, or leg weakness, or difficulty in speaking, it's a painless condition. Sometimes it can be easily neglected. And our main values are saving the family and loved ones, and especially the people who are really already suffering with the heart problem. These people are more likely to have stroke. Like we discussed, the clot can go from heart to the brain very fast and cause the stroke. And also, if there is any history of family history of stroke, also these people can get brain stroke. And all this can be prevented by just knowing the simple signs, which we are going to discuss. Even at the home or office, we can try to prevent the stroke. Are you clear? I am audible?
Yes, yes, Ganesh,
Yes, sir.
very much, very much.
Okay. And I think in this period, you can even, I think you may be already knowing, you can take the screenshots, photos, and you can write it in a book. If you have any questions, we can just in the beginning, I made this this thing. I think Dr. Nithin has already spoken regarding this. And I would like to this I made our audience to make it simple, because especially it is for the general public, general people, I thought. And this what meanings you should be aware to know the brain stroke. Okay. And ischemic stroke. Ischemic stroke means there will be a blockage in the brain vessel. That yellow the fatty plaque is there. No? This is the vessel. And you can I will show this also. Our brain vessel will be like this. Okay. And inside there will be a clot, and it can produce ischemia or arterial stroke. And hemorrhagic stroke means there will be a damage or tear in the vessel wall. And TIA, transient ischemic attack, mini stroke, means the most of the time the recovery will be within 24 hours. Next is thrombolysis, like our Dr. Nithin was mentioning. Most of the time these are clot busting agents. And thrombectomy means that the procedure where will remove the blood clot which is in the brain or in the neck vessel. And aneurysm means that ballooning out of the vessel wall. Okay, these are the words we should know. And AVM means arteriovenous malformation and abnormal thin blood vessels, and it can look like this. Okay, it will be very thin vessels. Any pressure fluctuations, it can cause bleeding or hemorrhagic stroke. And ICH means intracranial hemorrhage. Stent retriever means like it will be like a basket like device, and which will be used to take out the blood clot. I hope I am clear. whatever the meanings which we are using or we are going to use, just to make it simple, right?
Yes, sir.
Please, guests who are attending, if you are understanding this, please type yes, we are understanding. So I'll be knowing. Good, excellent. And why we are doing this? Our main goal is to save the life of the people and prevent the disability. And I would like to share my one of the childhood experience. Actually, my native is Kollegal, about 140 kilometers from here, which is Chamarajanagar district. When I was a small boy, around 6 years, 7 years, I grown up like that till I joined my medicals. So I used to see the people who are adults or elderly people who used to get a stroke. Lakwanta ಹೇಳ್ತಾ ಇದ್ರು to tell this thing in Kannada, or paralysis attack. They used to lose speech, and hand and leg should have been weak suddenly. What at that time the general treatment was just they were keeping the patient or person outside, we'll call veranda or jagli, we used to tell. And over a period of 1 or 2 days, they used to feed water, milk, or some banana juice and all, even though if he is not able to swallow or able to swallow. What should have been happened over a period of time, either he was not able to stand, sit, or eat. He used to die either with the starvation or because of the complications of the bed sores or infection. And ultimately, at the end of probably 1 week or 2 weeks, he used to die. And people who, even though if they survive, they used to remain with deficits, even though youngsters. And I used to wonder, see, why it is happening like this, and what is the cause. I was really getting sad, and I want to in the future, when I become a big person, I will prevent this. I want to give the treatment for the this world. That was my childhood experience. And over a period of time, when I joined MBBS, and then I joined neurosurgery, and when I did the endovascular surgery, even when I was in doing the DNB neurosurgery residency also, this whatever that just now we discussed, thrombolysis and thrombectomy, was not that much effective. Even mechanical thrombectomy was also we were not doing when we were residents. And this mechanical thrombectomy or endovascular surgery, when I went to Switzerland and learned this, then I got a confidence. Okay, I can also reverse the stroke by removing the clot in the brain. And this fascinated me. And that this we are practicing thrombolysis and thrombectomy, everything. So this is my childhood experience I wanted to share in this context. And I hope I am audible to everyone. If not audible, please.
You're audible, sir. Very much audible, sir.
Thank you, thank you, thank you, Jayashree.
Yeah.
And that's why we want to save more lives and prevent the disability as much as possible. And coming to the facts, few facts I think Dr. Nithin has already told. I would like to this thing like stroke is treatable, and most strokes have warning signs, and 1/4 will be having recurrent stroke. And WHO says these specialized stroke units, our Dr. Nithin was mentioning, or comprehensive stroke center, this increases the outcome of brain stroke by 14%, and clot busting agents can really make a difference of improving the quality of life by 30%. And clot retrieval treatment like stent retriever, it can improve the quality of life by 50%. This is what WHO says. And myths of stroke. If to the guests, I would like to ask if you know any myths, or if you know whatever the stroke you want to know, please type in the chat box. So we will get back to you what you know. Now I'll show what are the myths which can be there. Please type. So let it be interactive. If you know something about stroke, brain stroke, please type in the chat box. I think simultaneously, I'm not able to see. Jai Shri, you can make a note, or if our Naveen can make a note, if
Sure, sir.
yeah. I'm going to show the myths. Shall I? Please type yes. Say hi. Once we get the stroke, it's a permanent disability. Actually, it is a myth. Okay, and the stroke can be reversed, and stroke cannot be cured. This is also a myth. Stroke if you come in a golden hour, definitely it can be curable depending upon the patient's condition. And stroke will happen only in old age people. No, this is not true. Children and adults also can be affected by stroke. And once stroke, patient will die ultimately. It is also myth. And stroke is a cancer. It will spread to other things. No, it is not a cancer. Actually, whatever I have putting here, I had received the messages, and after our discussing with our patients and colleagues, I have put this. And stroke is treated by oil massage, and so many people get misled initially by this. This also myth. And stroke can happen only in the heart. I think Dr. Nithin has told that, and there is no cure for stroke. And yes, there is a cure for stroke. Stroke doesn't require immediate care. This is one of the biggest myths I can tell. So many times, whether they are waking up and realizing undone leg weakness, or they will see the patient who is seeing the TV collapsing with the right hand leg weakness. If they delay, then the possible outcome will keep on reducing, because our Dr. Nithin has already mentioned 1.2 millions of cells each and every minute. It will keep on dying, and it will become permanent. And stroke is a painful condition. Stroke is initially it is not a painful condition, but later it can become painful for the patient, and also for the families and others maybe knowing. Am I clear? There may be so many other myths we can discuss always at the end if anything is there. Just quickly, I'll go to the types of stroke. Our Dr. Nithin may have already discussed regarding this. I'll not go into the detail of everything. Okay. My screen can be seen, Jayashri? My screen is seen? Hello? My screen is seen. Am I audible?
Yes, sir. Yes, Ganesh, you are very much audible. Screen is very much visible.
Okay, fine. Thank you. And like ischemic stroke, we our Dr. Nithin had already discussed, and how the person will be having ischemic stroke means artery will be blocked here, and CT scan either maybe normal or dense MCS sign we will tell. And if there is a vessel inside, the clot is there, and that can be sometimes seen in the CT scan. And if there is no blood clots, that means ischemic stroke. And it is very important because treatment changes. Because if there is a block, we have to open the vessel. And now 3.5 to 4.5 hours for the thrombolysis, and 7.2 hours and beyond for the thrombectomy. Thrombectomy, like I discussed, removal of the clot in the brain vessel and re-establish the circulation. And how we can help? We can identify the cause in the CT scan, MRI, basilar artery, and perfusion studies we can show. And we are going to share a few stories of those people who have recovered from ischemia at this end. Okay, and hope I am clear with ischemic stroke. I'm going to close it.
Yes,
so,
sir.
Okay, and hemorrhagic stroke. And hemorrhagic stroke, like I told in the beginning, Dr. Nithin has also mentioned, artery will be ruptured, and CT scan will be filled with blood, or blood will be seen in the CT scan. And it is very important because if there is any bleeding, we have to either stop the bleeding and we have to treat the cause. And how it can help because if there any bleeding in the brain, like hypertensive bleed, blood pressure is shooted up and the vessel wall is burst, and it has caused the hypertensive bleed, and it can be managed medically or surgically depending upon the size of the clot. And aneurysm bleed, this also depending upon the location of the aneurysm, depending upon the size of the aneurysm, we can manage, we can treat it and prevent the further bleeding is the main goal. And for the same for the AVM also, arteriovenous malformation. And tumors, some tumors are there. Tumors also can cause bleeding and neurological deficits like glioblastoma or oligodendroglioma, or we'll tell pituitary adenoma with apoplexy. All these tumors can cause bleeding, and that requires to be treated. We have to be aware of it. And stories we will change. This is regarding, actually stroke means only three kinds mainly, that ischemic stroke, hemorrhagic stroke, and mini stroke. I'm adjusting my screen depending upon the mind map. And mini stroke, like as I have mentioned, mini stroke, there will be a stoppage of blood or there'll be transient flow of blood will be stopped to the brain or part of the brain. And CT scan may be normal in this, and Doppler or angiogram will find out narrowing of the vessel. And mini stroke, always there will be a reduced blood flow or stoppage of blood flow. And it is very important to know whether this narrowing is there in the neck or in the brain. And we have treated various patients actually. Those people, examples I have shown here: middle cerebral artery stenosis, basilar artery stenosis, and we have done the carotid stenting for that one, and carotid endarterectomy and bypass, and all these things we have done. Hope I am clear with types of stroke, ischemia, hemorrhage, and mini stroke. Let us go to the treatment aspect of stroke. I'll medical, I think Dr. Nithin has already told regarding the blood thinners, ecosprin, clopidogrel, fat lowering medicines, and thrombolysis like clot busting medicines can be this thing. And I'll hold it. Coming to the surgical aspect, that main thing we need to highlight in it because of the time constraint. And also one more thing, because it is a general public, so many images and videos we have of surgery, because it is everywhere we'll be seeing the blood, because this is the first time we are not showing that pictures of blood. So I am not showing any pictures of surgery, anything which contains blood. And I'll explain in the simple terminology what kind of surgeries it can be done in brain stroke. See, decompressive craniotomy. Decompressive craniotomy we will do. Decompression means we are providing the space for the brain to expand. Whenever, see, our brain has two parts, right and left. The right part controls the left of the body, and left side controls the right of the body, along with the speech our Dr. Nithin was talking about. If there is any stroke, the brain cells, it will swell. Along with, because dying cells, it will die, and over a period of 2 days or 3 days, as early as 1 day, can this midline shift or mass effect can happen. Our Nithin showed a very beautiful image of CT scan, which is causing mass effect and midline shift. And during this phase, this time, what happens? Our brain, even along with the cells which has died, normal cells also it will be died, because skull is a contained space. The brain will be very compacted. God has given a very nice skull to protect it, and inside blood will be there, brain tissue will be there, and water will be there. So if one side of the brain get affected, it will then it will shift the brain and it will presses the opposite brain and also the brain stem. Just to show the model, this is half of the brain. You can take like this off, another half will be there. See, these are various this thing: frontal lobe, temporal lobe, parietal lobe, and cerebellum, and where and all it can happen. It is half of the brain. If this half of the brain affects this, what happens? This will shift and compress the opposite side against the skull. So at that time, what we will do? Small portion of the skull will do the craniotomy and will remove. So this brain, instead of shifting this side and compressing the brain stem, this is the brain stem, and where heart centers and respiratory centers, everything are located. This is cerebellum, pons, medulla oblongata, and midbrain. So this is this part is very crucial for us. If this is not there, it is like almost brain dead. Okay, so we have to protect this portion. So a small portion of the skull will be removed. This is called decompressive craniotomy. And EVD, like I mentioned, EVD, external ventricular drainage. So brain contains water called cerebrospinal fluid. This water will be drained temporarily for some fluid, so brain will occupy that space, and it won't get damaged to reduce the pressure. Okay, once this happens, craniotomy and EVD in the initial phase of the stroke, then over a period of time, 6 weeks, this brain will, the swelling will reduce. Then we will do the procedure called cranioplasty and we will replace. This is for the arterial stroke. And if there is any hemorrhagic stroke, example, most commonly clot within this thing, we'll do the similar way. We'll remove the bone and we'll remove the clot, and then we'll put it back once the brain swelling reduces. And the aneurysm rupture, like ballooning out of the vessel and rupture, it causes, then we'll do the craniotomy and clipping of the aneurysm to prevent the further bleeding. And carotid endarterectomy and brain bypass. And these are the procedures we'll do for transient ischemic attack I was discussing about. So if any transient ischemic attack, if there is any narrowing of the carotid artery or middle cerebral artery, we'll put a stent which enhances the blood flow to the brain and facilitates the brain and prevents the further stroke, happening of the stroke. And these are the surgical procedures, few surgical procedures. And brain bypass, this is most commonly done in moya disease. Moya disease, what happens? The brain vessels, it get obliterated and blood supply to the brain will be reduced. So for this, we'll connect the bypass. We'll take the one of the vessel, radial artery or saphenous vein or superficial temporal artery, and we'll connect it. I hope I'm audible. If any difficulty,
yes, very much audible.
Okay. And endovascular procedures. What endovascular procedures will be helpful in stroke? Initially, as soon as the patient comes with signs of stroke, sudden onset, facial weakness, hand weakness, leg weakness, what we'll do after initially assessing, we'll do the CT scan we'll assess him and do the CT scan or MRI scan, and then we'll see where is the blood vessel occlusion, whether it's in the neck or in the middle cerebral artery, clot, if it is there. And we'll take them to cath lab where it's a fluoroscopy, and we will give a injection to the groin the artery called femoral artery, and we'll do the diagnostic cerebral angiogram, and we'll find out where exactly is the clot. And once we know where exactly, then we'll put the small catheters or wires, guide wires, and we'll reach that space, and we'll do the procedure called mechanical thrombectomy. Mechanical thrombectomy means mechanically we'll go and wherever the clot is sitting, we'll catch hold of this and we'll remove. This is advanced procedure, and it is device we'll use a stent retriever, and it's a basket-like device, and extract the clot sitting in the brain vessel and re-establish the circulation and affected brain in the golden hour. Just would like to show you with a homemade the vessel I have made, homemade vessel. You can see this. and you can see this. What happens? The example, clot is sitting inside. If we think, okay, okay, clot will be sitting, and what we will do, we will with the groyan, we'll go through the ascending this one, descending aorta, arch of aorta, and then to the carotid artery or in the brain. If it is sitting, what we will do? This is actually brush. It looks like a stent. Okay, you can see this. It will be like this. Stent almost will be like this, and to the vessel also, it will be like it will be introduced. And if any clot sitting is there, just will remove this. Okay, this procedure called mechanical thrombectomy. Same thing we'll do in the brain and neck. Okay, hope I am clear. If it is clear, please type clear in the chat box so we'll know. Thank you. And carotid stenting. Carotid stenting means, see, the vessel will be going there. It will be narrow. It will be narrow. Like if you press like this, it will become narrow. Yes. So blood supply from the other side, it will be compromised. It will be compromised. And then what we'll do, we'll insert the stent. We'll put the stent basket-like device and facilitate it. So most of the time, what happens, 70% and below, we can manage medically with the blood thinners and fat-reducing medicine. And after the stent, blood flow will be facilitated. This procedure called carotid stenting. In the same way, heart also, they will do the stenting. You may have heard of CAG, coronary artery stenting, post PTCA and all, you may have heard of it. And endovascular coiling of the aneurysm. Aneurysm is a ballooning out of the thin vessel, and groyan puncture will be made. And whenever aneurysm has a narrow neck or wide neck, all these things we'll study in the initial DSA. And main goal of the endovascular coiling is prevention of the leakage of blood. And here coils will be inserted that we are going to show you now shortly. And thin wires and catheters are inserted in this. And embolization of the AVM. It's abnormal embolization of AVM is a bunch of abnormal thin vessels in the brain which can leak and can be treated by injecting the glue or excision of the AVM. And flow diversion. Flow diversion is an advanced procedure. And when this when applied to the when this is applied, blood flow to the aneurysm will be diverted. And it is especially helpful for wide neck aneurysms. And aneurysm will be ultimately, it will be thrombosed, and prevention of the leak will be prevented. It prevents the leakage of the blood. I hope I am clear with my treatment part. If it is clear, please, if you have understood, please type it is clear in the chat box. See, you can type it. Okay, and now, along with me, I'll introduce Dr. Manjunath, who will present a short PPT of patients who how they came, how they improved. Along with that, I'll also be presenting one case.
This is the first case. This is a case of arterial stroke who came to our hospital. His name was Mr. Raghuveer. He was a 25 years old person who had a heart problem since childhood. It was called a DCM, or dilated cardiomyopathy, and he was on blood thinners, which was irregular probably. He was also waiting for a heart transplantation because he has this childhood condition. He had a sudden onset of weakness of the left side from 1 hour. He was shifted from his home to our emergency services in ambulance, and he was evaluated, neurologically assessed by our emergency team, and our neurologist also, Dr. Nithin sir also had evaluated him. We did a CT scan for him, which was normal, and there was no bleeding. And but when we did the CT angiogram of the brain, it showed right MCA block. MCA is short form for middle cerebral artery. So because of his heart problem, a clot had formed in his heart and it had migrated into the vessel of the brain, and it has stopped the blood flow to the brain. Because he was in golden period, it was important to remove this blood clot from the brain vessel. So we took him to a procedure room called cath lab, and there is an artery in the groin for every person. So it is called femoral artery. Through femoral artery puncture in the groin, we inserted a series of catheters and guide wires. We did a DSA and we mechanically removed that clot. It is called as mechanical thrombectomy. So here we used a basket-like device called stent retriever and removed the blood clot. So the blood clot, the blood flow to the brain was re-established. So this prevented further brain cell damage and saved almost half of the brain. The procedure went on well. So you can see here, this blood vessels are not seen. The blood in this part is not seen, which is also noted here. And here you can see the blood flow being absent. So when we did the DSA, you can see there is no flow here, while once the clot was removed, once the mechanical thrombectomy was completed, you can see the blood flow being re-established, all the blood vessels being seen. So this is the clot which we retrieved. This is the stent retriever, and the clot was put in a small bottle here. There was no complication for him. He was in ICU for 1 day with ventilator support because he had his cardiac problem also. Next day, he started opening eyes, started moving limbs on the left side also. That was the weak side with which he came in. And his ventilator support was withdrawn. Physiotherapist made him walk next day of the procedure. He regained his limb power completely and he was discharged after 3 days. We are continuously following him up, and he also underwent heart transplantation after 6 months of that mechanical thrombectomy. Now he is doing well. He is back to his work also. So just as a just for you to know, so this is the femoral artery. So we puncture here, we go up all the way from here to the aorta, arch of aorta, and from arch of aorta, we ascend up into the carotid vessels. Carotid vessels are the ones which go to the brain and give blood supply to the brain. So this is the right carotid artery. It is called internal carotid artery. This is the left internal carotid artery. This internal carotid artery branches out into two. One is middle cerebral artery here, and one is anterior cerebral artery, which is here. So the right part of brain receives blood supply from these two vessels in front, and left part of brain receives blood vessels from these two vessels in front, while the back portion of the brain and the brainstem and small brain, that is cerebellum, these vessels supply the back portion of the brain, cerebellum and brainstem. These are called vertebral arteries. These two vertebral arteries become one, united, and become basilar artery. This basilar branches from this basilar artery give blood supply to cerebellum and back portion of the brain. So this is the second case.
Second case, yeah.
This patient had a transient ischemic attack, which is known as mini stroke. So this 50 years old Shahnaz Begum had come with history of sudden onset of left-sided weakness and difficulty in speaking from past 10 days. It was on and off. It used to last for a few minutes and it used to resolve on its own. She was initially treated in local hospital at her place in North Karnataka. A CT scan was done, which was normal. while her MRI brain showed ischemic stroke in the right frontal parietal region. Small area of her brain had ischemic stroke. So the MR angiogram of brain was done, which showed more than 90% stenosis of right MCA. The right MCA, middle cerebral artery in her, was small, had become small. The blood flow was very minimal in a part of her MCA. And this kind of situation, if we don't treat, further blockage of this artery can cause major stroke and permanent weakness on the left side, because this is the right middle cerebral artery. Left side can become permanently weak, and that can lead to lifelong disability and lifelong dependency. So the blood flow to the right brain was getting interrupted because of this narrowing. So we suggested them, and they underwent a procedure called stenting. It is a minimally invasive procedure. So through a small needle prick in the groin, uh, uh, it is called as femoral puncture. Small catheters and wires are inserted, and through this we image the brain vessel, and we reach the narrowed portion of the brain vessel, and we place the stent. So the stent widens the narrow vessel and makes the blood flow to the brain easy and prevents stroke from happening in future. So this is her MRI, which is showing these whitened spots. What we can see here are the stroke, ischemic stroke, which happened in her. So this is her MR angiogram. You can see there is disappearance of blood vessels, a blackened out portion here. So this is the narrowed portion of MCA, right MCA. So once we did the DSA, cerebral angiogram, we could see there was this portion, there was almost no blood flow. So once we placed the stent, you can see the blood flow is restored. And next day when we did the CT scan, we could find the stent in the right MCA. So after surgery, she had no complication as such. She improved well, got discharged after 3 days. She is on follow-up and she is doing well. Thank you, sir.
Thank you. Thank you, Manju, for your presentation. This I'm going to tell about is hemorrhagic stroke. Okay, and where there was a rupture of the aneurysm, and he's an engineer working in his place, and he had a sudden onset of headache and unconsciousness. Initially, he was taken to some hospital and then brought to our hospital, and it was showing subarachnoid hemorrhage in the basal systems and also intraventricular hemorrhage, blood in the brain, and we had to rule out the cause from where the blood has come, because it was a spontaneous hemorrhage. There was no trauma, and we did the angiogram, which showed the basilar top aneurysm, like Manju told about basilar artery. Now there was a aneurysm, and treatment options were discussed, and after discussing risks and benefits and all, there was two options, like a clipping of the aneurysm or coiling of the aneurysm, where I'm not able to see this thing. Just a minute. Okay. Okay, and what we started on the medicines, and he was unconscious and intubated, and he was ventilated. We were put on the ventilator, and we took him to fluoroscopy room to treat aneurysm, and anesthesiologists were involved, and neurosurgeon and endovascular surgeon, and myself, neuroendovascular surgeon. Me and my team did the procedure, and we did the puncture of the vessel in the groin called femoral artery, and small tubes and catheters are inserted, and aneurysm was identified. And we used thin coils and platinum coils to seal the aneurysm, and we used the balloons to guide us to fill the aneurysm to prevent the rupture. And we checked all the major vessels which are normal and patent. And after the procedure, patient was in the ICU for some time, and gradually he recovered, and he was in the vasospasm. He had to undergo tracheostomy, small procedure, to make him facilitate to come out of the ventilation, and to facilitate for him to cough the sputum. And he was unconscious, and gradually he started opening the eyes, and gradually he was moving the hands, legs, and all everything. And later, once we weaned off him successfully from the ventilation, and he was opening eyes, then we shifted him to rehabilitation center, where he rehabilitated, provided the limb physiotherapy, all everything. And this was his initial CT scan. You can see the normal brain our Dr. Nithin had shown in the other off, and there was blood everywhere. There was no space for the brain to expand, and we had to find out the aneurysm, and we can see the aneurysm here in the basilar top region. And you can see the DSA picture. This is like a ballooning. This is a normal vessel. Usually this will not be there. See, this is called basilar top aneurysm, and which is need to be treated. You can see this before and after picture. It is after the coiling, and these are the balloons we use to fill the aneurysm. To we have to take we will expand the balloon, and we'll push the coils, and then we will leave it, and then it will stay there. And this is the exact picture. You can see the coils are inside, and we are filling the coils and endovascular coiling, and 3D picture which is there. And once it is coiled, and this whatever the leakage from this thin wall or weakened wall, it will be prevented. This is after the next day CT scan, which we have done, show the coils in place. And now after the follow-up of almost 10 months to 1 year, and he can walk independently, he can join his, he has already joined his work, and now he is able to lead his life almost like before hemorrhage. Okay, and aneurysm is a very deadly condition, and most of the time people will not reach the some percentage of the people will not reach the hospital only, and before reaching the hospital they'll collapse. Okay, and those who reach us, if they avail the treatment in the correct time, definitely it will be if they undergo treatment, we can treat them. And this is one more case. Because of the time constraint, I'm going very fast. And this patient had a 31-year-old, again, software engineer, who had a high BP and intracranial hemorrhage, and you can see BP was 200 by 140 in the beginning, and sudden onset of weakness like hand weakness and leg weakness, and grade 0, maximum is 5, and there was no movement in the hand and leg and all. And initially the repeated CT scan, we saw there was a large blood clot in the brain and temporoparietal region, which was causing the mass effect and midline shift. And we did the craniotomy and decompressive craniotomy, and prevent the herniation and prevent the compression of structures well. And gradually, actually, I was also not expecting if such a big blood clot in the hand and leg weakness will improve, but patient showed gradual improvement, now around grade 3+, and can stand independently, walk independently, and doing some of the things. And you can see the blood clot here. Okay, and this was the beginning of the CT scan, and once she started deteriorating, and the breathing difficulty and weakness was improved, and there was a pupillary asymmetry, then we decided to remove the portion of the skull you can see here. Now can walk with a spastic gait, and now subsequently undergone 3D printing cranioplasty as requested by the patient and attender. Okay, and one more. This is one more patient, 40-year-old, who had a pituitary adenocarcinoma, and through the nose and post-operatively radiotherapy was given, and then later follow-up MRI showed a large IC aneurysm, and various options were discussed, and brain bypass, flow diverter, clipping, and everything was discussed. After explaining the risks, we did the flow diversion. You can see the aneurysm in between the petrous and the lacera segment will tell. And you can see the aneurysm. There is a ballooning out of the vessel, and you can see the measurements. You can see we have applied the flow diverter from here to here, and see immediately after putting the flow diverter a few minutes, and the aneurysm started obliterating. Stasis in a delayed phase, you can see. Okay, and now there is no filling, and it is called flow diversion because flow, instead of going to the aneurysm and which busts and causes major bleeding and death or disability, the blood is not entering, and now vessel is fine, and rupture of the aneurysm is prevented. Post-operatively, patient did well, no complication, now back to normal and doing well. And without taking much time, I will end as early as possible because already it is so late. And what makes neuro services effective and quality? Emergency services, neuro monitoring, neuro microscope, instruments, neuroradiology, neurointensivist, neurosurgeon, neuroanesthetist, cardiology support. All these things are required for better to produce quality of neuro services. Under other things, the team plays a very important role. I won't take much time. And are you clear? I think my presentation I'm ending here. And neuro wellness, like we started in 2014, Fortis Hospital. Presently, we are there, and we are in social media, YouTube, Twitter, and link, and Facebook also. We are there just for information. And this presentation also will be uploaded in the YouTube subsequently. I'll check with my team, and the take-home message, like you have to be aware of mini stroke, and golden hour is very important. Stroke is treatable and fast. Facial weakness, arm weakness, leg weakness, speech dysfunction, we have to recognize, and we have to reach the hospital as early as possible. Comprehensive stroke care centers will make a very important role in preventing the stroke and preventing the disability. In our life, the exercise, 1 hour walking or aerobic exercise, adequate sleeping, nutrition, meditation, no alcohol, no drug addiction, no irregularities in taking the medicine, especially blood thinners are very, very important, because blood thinners acts like a double-edged sword. If you are a heart patient or a brain stroke patient, what happens if there is any stent or any heart valve or anything? If blood thinners are advised, if you take the blood thinners, everything will be fine. If you don't take the medicine, blood will be clotted, and it will be it may cause arterial stroke. Or if blood thinning medicines, if you take too much also, it can cause bleeding in the brain. If hypertensive medicines also, if you are not taking the medicines, it can cause high BP and rupture of the blood vessels and causes stroke. And this is especially blood thinners are very important. Please follow your doctor's advice. I think with this, my presentation will end. Any questions you can ask. I will hand over to Jayashree.
Yeah, this is for the audience now, like, listening to all the thoughts, like, the process of how to identify the stroke and why it is important. As Dr. Nithin and Dr. Ganesh rightly said, maybe, we neglect the stroke than the cardiac or the heart attacks because it's painless. That's the one most thing, because we do not understand it is really happening something inside our brain, and it is only the outside physical appearance, like the BFAST, what Dr. Nithin was presenting. It is always seen in the physical appearance rather than no pain has been told by the patients, or it has been understood by the family members. So we delay in identify the things, and it is very, very important to identify the fast, because it's now I think the audience have to come up with the questions, because I think in Kannadadallu kelbodu nimge, because it's first time, as rightly said, Dr. Nithin and Dr. Ganesh is hosting and organizing this webinar like this. I think after COVID, we are coming up with the online webinar for the first time with the neuro, and especially coming with the cardiac. Always the doc, as sir were explaining very clearly, cardiac or mild chest pain is also now they take it so serious. Even if it can be a gastritis, they just rush to the hospital thinking that it is a heart attack. Unfortunately, even you have a small headache, we neglect, and there are lots of things over the counter. They take just medications by their own, and they neglect. Probably it leads a lots of harm to the brain, and then they come and present to the hospital with a delay in presentations, and it becomes a difficult task for the doctors to manage it, and then it leads to the surgery. I know it goes into the surgeon's hand to deal it, and probably the patient needs a hospitalization for a longer duration. So it was really a very well crispy classes. I understand there was a little time extended, but still we had a lots of questions.
I think one of our patient wants to share his experience.
Yes, sir.
He is getting late, it seems. We'll ask him to share his experience. I think Hemchandra, you please share your experience.
Good evening, sir. Good evening, all of you.
Thank
Good
you.
evening
Thank
to
you.
all Ganesh team, sir. He treated me very well. And
Thank you.
I cannot say.
Please, don't worry.
But I'm okay.
Don't worry, Hemchandra. I can understand. Make yourself all right. Don't worry.
Yes, sir. Sir, I'm okay now. I'm doing it. I'm doing the. I'm attending my site work also. I'm going my home right now. I'm attending my patient.
You can tell in Hindi also, no problem. Share in Hindi only, no problem.
अच्छे से रिकवर हो गया हूँ और मैं बहुत अच्छा फील कर रहा हूँ. You can talk to my wife. She can.
Yeah. Please give to your hand over to your wife. Let your wife speak.
Good evening to all.
Namaste, ma'am.
Yeah, namaste. He's very emotional now.
Not audible. So, little, can you loud?
Yeah. Good evening to all of you.
Good
Good
evening.
evening,
Good evening.
Dr. Ganesh is very nice actually. He treated him very well. He actually explained everything as a like family member to me. I'm very lucky he is the doctor who treated him. Actually, he's very emotional now. Not to speak, not able to speak. Everything,
problem.
history
No
and
problem.
all.
That's okay, ma'am.
Now he knows it.
Consoling.
We thankful all the teams of Fortis actually. I know his history. I'm not telling him more about that because he will get tensed about it. Now
Don't
he
worry.
knows
No need
everything.
to tell, because I can understand.
Yeah.
Please console him. We are very happy for his recovery.
It is like
Please,
a miracle actually.
don't worry. God is there.
Yeah,
God
thank
is
you.
there.
Thank you so
No
much.
problem.
Thank you.
No problem. Take care.
Yeah.
Take care.
Yeah.
Yeah.
Thank you so much, ma'am. Do we have any other audience to talk?
Vidya P was there. Whether like to speak or this thing. Vidya, are you there?
I think she's here.
She's there. Vidya would like to.
Ma'am, you can
speak?
unmute yourself and you can just
Yes.
try to speak.
Yeah.
Hello.
Yes, ma'am.
Hi, Vidya. Yeah.
Hi.
Hi.
Namaste, sir.
Namaskaram. Namaskaram. ಹೇಳಿ ಕನ್ನಡದಲ್ಲೇ ಹೇಳಿ. No problem. Yeah.
ನನಗೆ
ಅನ್ಸುತ್ತೋ ಅದು ಹೇಳಿ, ಪರವಾಗಿಲ್ಲ, ಏನ್ ತೊಂದರೆ ಇಲ್ಲ.
2 months ಬ್ಯಾಕ್ ಆಪರೇಷನ್ ಆಯ್ತು, ಈಗ ರಿಕವರಿ ಆಗಿದ್ದೀನಿ.
Good, good, very good, very good.
ಏನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ, ಆರಾಮಾಗಿದ್ದೀನಿ ಈಗ.
Good, 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 very good.
ಗಣೇಶ್ ಡಾಕ್ಟರ್ಗೆ ಥ್ಯಾಂಕ್ಸ್ ಹೇಳ್ಬೇಕು. ದೇವ್ರು ಸಿಕ್ಕಿದ್ರು ಅವರು.
No problem. Thank you very much. Thank you. ನೀವು ರಿಕವರಿ ಆಗಿದ್ದು ನಮ್ಗೆ ತುಂಬಾ ಸಂತೋಷ. ಆಕ್ಚುಲಿ ನಾವು ನಮ್ಮ ಟೀಮ್ ಯಾವಾಗ್ಲೂ ನೆನ್ಸ್ಕೊಳ್ತಾ ಇರ್ತೀವಿ. ವಿ ಆರ್ ವೆರಿ ಹ್ಯಾಪಿ ಅಂಡ್ ಮೀ ಅಂಡ್ ಅವರ್ ಟೀಮ್ ಆಕ್ಚುಲಿ. ಬಂದಿದ್ದಕ್ಕೆ
ಒಳ್ಳೆ ಸತಿ ಪುನರ್ಜನ್ಮ ಕೊಟ್ಟ ದೇವ್ರು ಸರ್ ನೀವು.
No problem. No problem. God is there always.
Very nice, very nice.
Okay ಅಮ್ಮ. ಥ್ಯಾಂಕ್ಸ್ ನಿಮ್ಮ ಇಷ್ಟೊಂದು ಬಿಸಿ ಇದ್ರೂ ಬಂದು ಅಟೆಂಡ್ ಮಾಡಿದ್ರಲ್ಲ ನಮ್ಮ ಇದಕ್ಕೆ ತುಂಬಾ ಥ್ಯಾಂಕ್ಸ್. ಎಲ್ರಿಗೂ ಮೋಟಿವೇಶನ್ ಸಿಗ್ಲಿ. ಥ್ಯಾಂಕ್ ಯು. ಒಳ್ಳೇದಾಗ್ಲಿ. ನಮಸ್ಕಾರ.
ಧನ್ಯವಾದ ಮೇಡಮ್. It's so, it's a very good pleasure, sir, like, listening to the patient attenders coming up, our patients directly coming up with the feedback and talking about their recovery. That's more important. As you were conducting the webinars, like from the beginning, I was just thinking, like, why don't the patient attenders and the patients come up with their feedback and tell about how they have gone through and how it is a recovery phase as of now. As rightly you said, it's not going to happen within a day. The miracle does not happen within a day. The neuro conditions would take a few months or weeks or time. It depends from patient to patient. So this feedbacks makes lots of valuable inputs to our, in the further coming days. So that it helps all the patients and patient attenders or to, to take care of their loved and kids and kins. I think we have, I don't see any messages as of now.
Sure,
If
sure.
you are,
No problem.
yes,
They
sir,
always
if you are
can come
okay
back
to go ahead, like, we can, I think they can ping or message you back after this session.
Yes.
And we'll be, I think we'll promise, this is the first time we are conducting, so this is a promise. Probably next time we'll be having a much more better organized and, more panelists and more, the speakers and the conditions or the questions according to the conditions or the, the interest what the patient and